Hi, Dr. J. This is Jeanette Watson, doing a second video submission. Um, I'm actually glad that we're given this option because I am enjoying being able to do assignment without having to write it out. Gives me a break because been writing a lot of papers lately and getting ready. A lot of us are getting ready for comps and CPE, so we had to submit our documents just last week, and also write a lot of progress notes right now with the telehealth that I'm doing for my practicum site. So this option is nice to get a break from having to type. This is in regard to the assignment that is due this week, April 22nd. And it's looking at reading one of the articles and then also looking at the video from Dr. Sai. I was a little confused about that one because when I click on the link that you provided, it didn't show me a specific video. It took me to her page. And I looked in the press and seen other videos two videos that were titled what you have titled on here. One was like over 3.5 minutes and one was like 50 minutes. So I wasn't sure if those were even the right ones or which one we're supposed to watch. So kind of comparing based, if there's any comparison or connections based on her work, and also taking into consideration, the article and Dr. Sai's video, if there's anything that these resources would be able to help my work in the future. So I decided to read the article on the disassociation of emotion expression from emotion experience, a personality perspective. And questions asked are, what the author aims. So like article goals or assumptions. And really is looking like if there's a relation between experience and expression, which actually can be kind of complex. And is if there is a difference when it comes to positive or negative emotion. And so what they wanted to measure was if there was habitual emotion, so on the both negative and positive side. The author aims, the goals, assumptions of, characteristics, participant characteristics and measures, and finding, if there is a correlation between low expressivity individual experiences versus high expressivity individual in experiences when there's a negative emotion. So if there's a difference between either the low expressivity individual or the high expressivity individual. And so the participants, there's two studies in this, and both seem to be predominantly female. In the first study, this was more of like relational in aspects of like people knew each other, so they're like roommates, and had relationships before the study with one another. It said that there was some mix of like a mixed background, but on both studies there was still a higher percentage of Asians and Caucasians on both studies. The second study also looked at like showing, so basically showing a film, so like that would bring amusement, and then the second one like a funeral, so something that would bring sadness, and kind of comparing those on both studies, looking at the comparisons of how people who are of low expressivity versus high expressivity what the findings were. And so the findings were that they are different. And there was a comparison in the charts, which kind of were similar in the aspect of, let me find it, that when looking at the table of like fixed modulation, dynamic modulation, the high expressivity to low expressivity from low, medium, and high showed that it was sort of kind of parallel when you looked at both high expressivity and low expressivity in the subjective emotion experience. And then in the dynamic modulation, the low expressivity actually had a slight incline when it came to the high in the subjective emotion experience, but not super significant. But the high expressivity from low to high really shows a steep incline. But when they compared that to in looking at the following chart, and looking, let me see for this other chart. So in looking at the peer rated positive emotion expression and the peer rated negative emotion expression, once again, there's kind of a parallel in the positive experience with both high expressivity and low expressivity compared to looking at the negative experience and showing also that there was only a slight incline in low expressivity when looking at negative 1, 0, and 1, the way it was z-scored, compared to high expressivity showing a high incline as, starting at the negative 1, and as it went up to 1, showing a huge jump. And that was similar to the previous chart in the previous study. So kind of showing that there is some similarities. And so that made me kind of think about kind of like what Dr. Sai was talking about, how culture plays a role in expression and how we react. But going back to the study, there was one thing that said, like, in certain culture, like, if you bite your tongue, like, some might just not want to say anything, but in another culture, it really means that it's not that you want to say anything, but is that you feel like embarrassed. The other thing that stood out to me in the reading was that it said that those who are of low expressivity don't necessarily, like, they're aware that they do not have like a high reaction, and some choose to not have an overt reaction to things, and also could be particular that maybe in childhood or something that they were taught to, or something happened and made them feel like they were not able to or should not, or hold back from fully having like a high reaction. And so they tend to just be, more on the low expressive side. And so culture, I believe, like, that was one of the things in reading a little bit of Dr. Sai's write-up, and the video. And I, be fully honest, I only watched the video that was like over 3.5 minutes, but it made a lot of sense, especially in like Asian culture, which I have come across with, friendships that I've had in the past, and characteristics of individuals in the Asian culture of just not being super reactive to certain things. And so I think that it's very important to really pay attention to how culture really influences and impacts an individual, and what this means in treatment and therapy. Because if we don't take these things into consideration and maybe also analyze that, our client just might be of, a type of a low expressivity, we might be making assumptions as far as maybe in our diagnostics or in measuring like if our treatment is being effective based on our clients' like lack of expression. And it could be that there could be many factors factored in: their culture, how they were, what messages they received, even if culture didn't play a part, but were there messages that they received growing up that made them feel like they could not be super, have high expressivity. So that would be something to really keep in mind. And I guess by doing further like assessment and further research and asking more questions with our clients would be something that would help give us a better understanding. And this actually is important to me because I have a client right now who is, female, had some trauma, but noticed that she was kind of more of like a flat affect when talking about certain traumas that she experienced. But because my style is a little different when it comes to working with clients, I always, if I see like that there is not like progression, I like to challenge my clients. So it was really about challenging this client and saying, I really noticed that when you're talking about something that could cause like a negative emotion, I don't really see that in your affect and your tone, facial expression, body language, like seems just more just, you know, just flat. And so after, kind of, I guess, confronting my client with that and having further dialogue, it was just that my client has been taught to always look at the positive, even when there's negative things going on. And so she has learned how to not harbor so much on the negative experiences in the past, but to take that negative experience and turn it around into something positive as something that she learned, something she learned from to moving forward. So that's it. I also just wanted to take a brief moment to let you know that at times I'm probably going to be, like I previously mentioned, I just had a baby some months ago, which no one in my cohort knows. So I'd appreciate it if you didn't like blast it all over. And I'm welcome to having a discussion offline with you. If you question that, my academic advisor actually questioned me, like, how come no one in my cohort knew that I was pregnant and had a baby? But, and so I'm really trying to adjust right now. So at times I might just be quiet, maybe because I'm just really overwhelmed and exhausted with, continuing my program and trying to take care of a newborn and trying to do all the work that I need to do so I can still graduate on time and not feel like I'm, falling back. So just wanted to give that bit of information for you in case if you see that either I'm just like kind of flat or not really super enthusiastic or not really saying a whole lot in class. It's just that I have really bad postpartum. So I'm just trying to take every day for what it is, but still trying to get the most that I can from my classes and trying to repair myself cognitively, because I didn't know till one of my professors mentioned it to me, but when I was pregnant and up until I would say within a month ago, like I really have been feeling like been struggling cognitively a lot. And unfortunately, due to COVID, it really was coming to the point of like, okay, I need to make an appointment to figure out why my cognition is super off. But I'm working through it in my own therapy and obviously realizing that the pregnancy hormones, the lack of sleep. I only sleep like 2 to 3 hours a day, a night, really impacts cognition and, of course, like depression and everything else. So that's my spiel. Please let me know if there's anything that you need from me. But thank you again for giving us the option of a video. This is a lot more easier than having to type everything out all the time. Thank you, and see you in class on Wednesday. Take care.